This is Restorative Medical's Fluidized boot. It is wonderful for those patients that you really worry about skin integrity. The Fluidized is a medium. It's kind of a, if you will, a gel type substance, but it's wonderful. And it runs from the Achilles up the back of the boot. And if you can see it, you can just push in on it and mold it to your patient's the back of their leg, and it's very, very soft and feels like you're floating on a cloud. So people that are laying on their backs for a long time, you may have bed patients, you may have, let's say they're on a ventilator. Hospitals really like this boot because it protects, prevents a foot drop. If your patients have tone, it has neurological tone from some type of issue, and those diagnoses are kids with cerebral palsy. This is our pediatric boot. It starts at 3 inches in length, that would be foot length, and goes up to 8 inches. All the adult boots go small up to 8 inches foot length. Medium is up to 9.5, large is up to 11, extra large up to 13, and if you need larger than that, we'll make whatever you need. That's fine. But if you have an adult foot or whatever size age foot that's 8 inches, but it's more narrow, then you may want to order the pediatric boot, and that will give a nicer fit. This boot has the flex properties in the flex strap, so it allows you to push through that tone and spasticity. With many brain and spinal cord injuries, that begins the 3rd day after injury, so they're still in the ICU. So we need to identify that tone, and what that is, because of damage to the central nervous system nerves. You've got brain, spinal cord, spinal nerves coming off. The muscles contract inappropriately and they're not relaxed. So as they contract, they're pulling. So you'll see feet, hands, body parts start to twist and turn. As soon as that starts, we need to identify it and then fit the flex technology splint on them to continually relax that tone. If we relax the tone repeatedly, then we will prevent, if not all the deformity, we'll prevent most of it. And our goal is to have those people go from the hospital into the rehab with no deformity, and hopefully go through rehab and maybe walk home. That would be very exciting. We need to keep their bodies straight and in alignment. We really don't know what their potential is, but if they get through injuries like that and they're totally alert and oriented and would have the potential for function, but we've allowed their bodies to develop these physical deformities, then we're going to have patients that maybe can't return to the workforce where otherwise they could, or just be, if they're 80 years old, they can maybe continue to live at home or be more independent and mobile, but they might have to go to long-term care. And these are people of any age. We see young people in car accidents, falls. I mean, it's amazing. They fall down steps and hit their heads. Little children. So it's vital that we prevent these deformities, and we can. It's so different from orthopedic. With orthopedic, you're holding, you want a rigid splint to hold a body part in a certain plane to facilitate healing and function. You put a rigid splint on a neurological patient when they're having episodes of tone, you can kick in that stretch reflex to where maybe they're here and you aggressively stretch them too far too fast and they end up here. So we have to be careful, and it could cause them pain needlessly. We have to do the right device and then step back and watch how the body responds, and then we adjust our treatment accordingly. This boot, like all our other boots, has the non-skid sole. You want it on when they're sitting in a chair. Put it on in bed before you get them up so they don't slip during transfers. If they take a few steps, that's fine. It's not meant to walk to the grocery, but we can certainly take a few steps, but make sure it's on. But when you put them back in bed, take it off, because what's on the floor needs to stay on the floor. We don't want that in bed. You adjust this strap to whatever height gives you the best leverage to correct your patient's deformities, or certainly to prevent that foot drop. If you have someone in the hospital or in bed for a while, or whatever the reason is that they may develop foot drop. These are sometimes can happen so quickly, it's amazing. This boot, like our others, is very easy to put on. It's heat moldable, so you can mold it to fit any lost range of motion the patient already has. You always want to make the splint fit the patient, not the patient fit the splint. So you can refer to our website, or MMAR Medical website, for the videos that show remolding, and you would remold it here and go down. My rule of thumb is, if I can't get them passively stretched back within at least 15 degrees of normal, I'm going to mold this boot down. Yes, the boot is flexible and they can push on it if you don't mold it. But if they have that 15 degrees or more of plantar flexion contracture, they could slide as they're pushing, and we don't want that. It could sit up shearing. If their foot is twisted, you want to mold it to fit that whatever that deformity is, that shape. But by remolding the boot down, you can cinch their foot on it. Then when they push into the boot, it provides that fishing pole type of flex technology that is the tension that's going to relax their tone. Then the prolonged low load passive stretch, that takes about 6 weeks to realign the actin and myosin in the belly of the muscle. It's in sarcomere units, and we have to go through that process to prepare the muscle to be re-lengthened. So we always want to tell our patients and their caregivers, whoever that may be, that not to, if they have contractures already and have shortened tissue, that they need to wear the boot for a couple of months before they expect to have great results, because we have to prepare things in the muscles that they can't see. We don't want them to get disheartened and think they've worn the boot for a week and it hasn't done anything. So if they understand the process that we go through, that their body has to go through, that's sometimes hard for we clinicians to not want to correct them immediately and shove it up. But we have to fit the boot to be appropriate for them at that time, just to work through tone and spasticity. Let it relax, and then the prolonged low load passive stretch to prepare them to be re-lengthened. And we step back and watch the patient's body do what it should. Now, even though it's molded down, the black flex straps will bring the boot up, so you may not have to remold it, certainly not very often, but you can as is appropriate. Every patient is individual, but the flex straps do have elastic properties that allow you to push in. It's very easy to put on and take off. You're going to open up your flaps. When you initially fit the boot, you either loosen this or lay it aside. You're going to open up all the straps. Now, this boot has our Restorative Medical signature silky black lining. It's very, very patient friendly. It has natural wicking properties. It keeps you cool and dry. We also have a fluidized boot that has Outlast. And actually, our hand splints are lined with Outlast, and you can ask for any of our products. with the Outlast lining. It is a thermal regulating fabric. It was designed with the scientists at NASA for astronauts, so the clothing and equipment they wear when they're on spacewalks and on the space mission, that it keeps their body at a normal temperature. We do not want astronauts sweating, so it goes through a phase change. If your body heats up, it will absorb energy, go through a phase change, and cool your body back down. If you cool down, it will go through a phase change and warm you back up. So we have exclusive rights, Restorative Medical does, to use these on our products. If you want more information about Outlast, they have a very good website. It's outlast.com, O-U-T-L-A-S-T. Okay, we're going to open this up, and then we open up the talus strap. And this one we can Velcro back on itself. Now this is the initial fitting. Again, we're going to seat the patient's heel as far as possible in the boot. I'm going to anchor their lower foot. I'm going to be holding it. So I typically work from the foot down. I'm going to hold their foot and anchor that. I may just do the talus strap next. It goes around. With these patients that have tone, we want to make sure their heel is captive. If that heel can slosh around in the boot, then we're not doing a proficient job of reducing that tone and maintaining alignment. So if you need to put little extra pads of material in there, you certainly can. You can see the construction of this boot is to attempt to hold that heel in place. And then this strap fits over the top of those to secure it. Now again, you want to run your fingers under each strap, under each edge. You want to feel that there's a pulse here on top of the foot, the pedal pulse. You want to observe the toes to make sure that they're a nice normal color. Any blanching, like white, or if they're pink or appear swollen, over pink, red, or if the patient complains of numbness and tingling. Now, some of the patients that these go on can't tell you if they're in pain or if there's numbness and tingling. So we have to observe and watch also. Okay, I'm going to secure this around the lower leg. Then I'm going to put on the flex straps. Now, this boot will do a certain degree of contracture. If you have feet that are totally flat with the leg, then you'll want to go probably to the flex boot, but this will do a pretty good contracture too. But you just need to adjust this at the right angle for the leverage you need to bring that back up, to bring that foot back toward correction. Again, you're going to, if the foot is going a little more that way, you'll tighten this strap. If it's going a little more this way, you'll tighten this strap. Just common sense. You want them snug, but don't just pull them so tight that there's a strain. You want them, if the foot is just going down, then you bring them up the same degree, but you want it just nice and snug. There's a rotator bar at the back. We put a label on because sometimes people don't look and find the rotator bar, but we want it covered. Anything that might cause pressure area potential, we want to cover it. Again, the first rule of restorative is do no harm while we're trying to correct something else. And our patients many times will cross their legs and rub, so we want to make sure if they only have on one boot that the rotator bar doesn't touch the other side, the other boot, the other leg. I'm going to bring out the rotator bar. If their leg is going this way, that's like a kickstand on your bike. If you'll think of it like that, it's very simple. You pull the other side And again, this is Restorative Medical's Fluidized boot.